Hi, this is Omar the pharmacist, live from Wiltopia Pharmacy. I, I am coming today to talk to you about very important things in relationship with the vaccine. The first update I want to mention is the COVID vaccine and pregnant women. And I'm reading this information from the CDC website, Centers of Disease Control, about the V-Safe COVID-19 vaccine for pregnant women, because I had to turn away some of the pregnant women who were trying to get the vaccine, and now I see what the CDC have published on March 15th. If you are pregnant, you might choose to be vaccinated when it's available to you. There is currently no evidence that antibodies formed from COVID-19 vaccination cause any problem with pregnancy, including the development of the placenta. However, data are limited about the safety of COVID vaccine for people who are pregnant. CDC established the V-Safe COVID-19 vaccine pregnancy registry to learn more about this issue. The registry is collecting the health information from people who received the COVID vaccine. So in general, it's voluntary. You can take it if you want to take it and participate to opt out at any time. And you can also discuss it with your OBGYN. But what I know is that the OBGYN groups are accepting the vaccination for patients who are pregnant. For women who I turned away, who wanted to get the vaccine, I'm sorry, it's just the information that I had at that time. But now it's being accepted with the CDC. The other information that is important is that now, starting next Monday, March 22nd, if you have a chronic health condition, you are eligible to take the vaccine as long as you're 16 years old plus and you have any of the following: asthma, cancer, cerebrovascular disease, which affect the blood vessels and blood supply to the brain, chronic kidney disease, COPD, chronic obstructive pulmonary disease, cystic fibrosis, diabetes, type 1 or 2, Down syndrome, heart conditions such as heart failure, coronary artery disease, cardiomyopathies, hypertension or high blood pressure. So if you're taking a blood pressure medication, you can take the COVID vaccine starting March 22nd. Immunocompromised state, weakened immune system from solid organ transplant, blood or bone marrow transplant, immune deficiencies, HIV, the use of corticosteroids or use of any other immune weakening medication, liver disease, neurological conditions such as intellectual disabilities and dementia. Intellectual disabilities, you can translate it as what? What's the intellectual disabilities? You can just translate it. We're not going to ask you for a proof for it. Obesity, body mass index BMI of 30 to 39 kilogram per meter square, or weight or overweight. So if you're overweight, your BMI 25 to 29, you are actually eligible to take the COVID vaccine starting March 22nd. If you're pregnant, pregnancy is now considered as eligibility to get the vaccine March 22nd. Pulmonary fibrosis, severe obesity for sure, sickle cell anemia, and thalassemia type of blood disorder. So individuals with those medical conditions can receive the COVID vaccine with Wiltopia Pharmacy or any other place that offer the COVID vaccine. I want to say that when we contact a patient and they tell us, or an individual to get the COVID vaccine, and they tell us that they got the vaccine somewhere else, we actually feel good for them. We feel happy that Wisconsin is having more places to get the COVID vaccine. We like this kind of competition. It's a competition to vaccinate as much people as possible in the shortest time. And we've seen now like more than 70% of 65 years old plus residents in Wisconsin have gotten 1 or 2 doses of the COVID vaccine. This is beautiful. I don't think that another state is doing this wonderful accomplishment. Some of the things that I want to mention, because we're transparent from day one about what we do and what happens with the COVID vaccine administration. Allergic reaction, we have administered until now about 6,000 COVID vaccine. We had just one severe allergic reaction. We had to administer the EpiPen for a Pfizer vaccine. The patient had actually used an EpiPen 3 times before that. She had a severe allergy before. We administered the EpiPen. We called 911. They came, and the patient didn't want to go to the hospital. She got stabilized after that by like 15-20 minutes from administration of the EpiPen. Actually, the patient wanted to get the second COVID vaccine. She told me, I'm going to be ready with my EpiPen but she's not eligible to take the COVID vaccine, the messenger RNA technology. We're going to check if she is going to be eligible to get another form of the COVID vaccine. But that's the severe allergic reaction, just one case in 5,000, and the current numbers are 11 cases of the Pfizer vaccine in 1 million, 11 in 1 million case severe allergic reaction. And we are trained, we're ready, and we are happy that the outcome was to the favor of the patient. She didn't even have to go to the hospital. Uh, about Wiltopia Pharmacy, the accomplishment until today, we're very happy to say that until now, like just last week, in one day, we went to a prison, to a church, to a mosque, and we administered 2 COVID vaccines to homebound patients. And that's kind of the vision that we wanted to have for our COVID task force, is to fit where we are needed. So I want to vaccinate where I am needed. And currently we have a focus on the places that have the least number of vaccinations. So guys, if you need us to send a task force for vaccination to a certain place, just let us know. We have 5 vaccinators on the staff. We have a team. We have a very efficient system to be able to do that. Okay. The other thing that I want to say is that we increase the safety measures in our room that we vaccinate on at Wiltopia in the 3rd floor. We got some remarks about social distancing, so we parted the chairs. We added only 11 chairs in the room, and we sent people downstairs to wait in the pharmacy after they get the vaccine. And we're trying to be more considerate to the number of people we scheduled at a certain time. And also, we're just kind of trying to take more safety measures as much as we can to make sure that you feel safe when you come take the vaccine. And when you come, please wear your mask and come at exactly your time slot. Now, for people I mentioned with the chronic health conditions I mentioned, please sign up on the website. We're pulling from the website every single day. We give priority to 65 years old plus. So if you're 65 years old plus and you sign up now on my website, please wait for us to contact you, because we're kind of finishing our 65 years old plus patients. If you signed up before 65 years old plus and you haven't received communication from us, sign up again and we will communicate with you. We're also partnering with a church, and the church is going to communicate with patients to get the vaccine at the church on Wednesday. This is a new partnership that we're doing. We're also partnering with companies. So if you own a company, if you know someone who owns a company, if you work in a company and you are an employee and you think that we can gather 50 or more people who are eligible to take the vaccine, health worker, educators, people with chronic conditions like hypertension or obesity or BMI 25 plus. I think a lot of people are BMI 25 plus. So we can come to your company, vaccinate everyone who's eligible, 50, 100, 200, 300 people, and leave. We're very efficient in our offsite clinics, and we try to communicate with restaurants, food chains, and we actually did a restaurant in downtown, and we vaccinated about 130 people of the restaurant employees. And that was actually very relieving to me, because I feel bad when I go to a restaurant and I just sit at the table and I just don't have my mask, and I speak with the server who is like doesn't wears a mask, and she's taking my order, and they are like population of the highest risk actually. So we're very glad that we were part of vaccinating people downtown. Again, we're doing mass vaccination in offsite clinics, so just let us know if we are needed. I kind of finished my summary for what I wanted to tell you. Homebound patients who need special service, we do it at their houses. We come to the house. I come myself. There is $50 one-time fee for every time that we visit. So if you come for the Pfizer COVID vaccine, the first time is going to be $50. Second time is $50. This is just for the visit of the pharmacist to pull him out of the workflow to come to administer the shot. And then we take all the information related to the consent form. We administer the shot. We wait 15 minutes or 30 minutes. I was successful to deliver 2 of those home visits yesterday. and we plan to continue doing them. And we encourage other independent pharmacies to do the similar service because it's needed. It's wonderful service, but I think only an independent pharmacy can afford to do it and arrange it. With Wiltopia, you send an email to covid@wiltopiarx.com. I will communicate with you directly myself. Currently, it's a test drive for the program, and we want to make sure that it works. And just let us know if we are needed in any service. Send us an email to covid@wiltopiarx.com or reach me through the website. You all know that I am easily reached, or even you can call or text the pharmacy at 262-429-9429. Thank you. I would love if you share this video for your friends, for your pregnant friends, women who need to get the vaccine. And again, I'm very sorry for people I turned away who were pregnant and the information was out there and I did not check. I checked it now and I see that we can vaccinate the pregnant women, breastfeeding women as well, as long as they are having the okay from their OBGYN. Thank you and have a wonderful weekend.